buy it. I'll buy it on simplyherballs.net.
Yes. I love it.
All right.
Let's do it.
We're ready?
Do it.
Okay. Sorry, air conditioner's going off.
It's going to get real hot. And
Talk fast.
Real fast.
We'll do this as quickly as we can. All right. Well, that fan down there is audible, though.
Can't hear it.
Okay, it's fine. A little white noise is okay.
Okay.
Nobody gives a shit. All right, here we go.
Sirius XM. It's time for Weird Medicine with Dr. Steve.
This one's isolated from the recording loop, so it's the only way they can hear the intro.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve exacerbating my inevitable woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest-running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider, who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacie. Hello, Tacie.
Hello.
And first time in the studio, excellent, glad to have you here, is Dr. Jeff. Hello, Dr. Jeff. Dr. Jeff is an osteopath, right?
Doctor of Osteopathic Medicine.
Yes. Okay. All right. It's like we're not supposed to say diabetic anymore. It's person with diabetes. You can't say you're an osteopath. It's
No,
a doctor of osteopathic medicine.
I don't practice osteopathy.
I got you. Anyway, this is a show for people who never listen to a medical show on the radio. If you got a question, you're embarrassed to take to your regular medical provider. If you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Most importantly, we're not your medical providers. Take anything you hear on this show with a grain of salt, and don't act on anything you hear without talking over with your healthcare provider. All right, very good. Well, welcome to the studio, Dr. Jeff. We're going to be talking about all kinds of stuff today, including osteopathic medicine, but we're basically just going to be talking about dicks and nuts and stuff like that, if that's okay.
Yeah, osteopathic medicine includes dicks and nuts.
Excellent. Okay, well, very good. Well, that's good to know. Check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And I really didn't do a whole lot of show prep today, and I'm sorry. I apologize for that. Unlike normally when I put in all kinds of time. And I forgot to take my medicine today. So this is going to be an interesting show. I'll try to make it halfway interesting. Tacie has topics. Let's do Jen and Carol's question first. I'm doing it blind. I haven't listened to it. And people were complaining that my bumper music sucked, so I'm just going to play their question.
Didn't you create that music?
Yes, fuck off. Yes.
Dr. Steve, I have a question.
We have a question.
Okay.
We have a question.
My entire life, I have played sports.
I have not.
When I exercise rigorously, I have always tasted blood in my mouth.
Oh.
Have you never had that?
No. I also have never exercised vigorously.
I mean, you had to have exerted yourself at some point.
I mean, you know what happens to me? I don't taste blood, but I get a very weird pain in my throat and neck, which probably means I'm having a heart attack or something.
When was the last time you had that?
I have it frequently.
Probably having a stroke.
That's what I'm thinking.
So I will actually taste, I'm not coughing, but my mouth and my throat will have a metallic taste. And I am convinced when I spit, it's
Right.
going to be blood. It's
And
never
it's not.
blood.
Right.
Oh, that's weird.
What is that? Is that something that I should be concerned with? Thank you.
And God bless.
That's Jen and Carol from the Mom Swipes Left podcast. Check them out at momswipesleft.com. And I have no effing idea on this one. Dr. Jeff?
Yeah, this is a new one to me too. I'm wondering how vigorous of an exercise are we talking about? Are they bearing down? Are they clenching down?
Yeah. Well, the thing is that we can't ask follow-up questions.
Yeah, it's unfortunate.
So we have to deal with what we've got. Now, she said that she exercises vigorously and has for years. So and then one of them said, well, maybe you're having a stroke. No, that's not it. Stroke is characterized by one-sided weakness of the body, not a metallic thing or, taste in your mouth. Tacie, what did you come up with?
Some of the excess hemoglobin released from the leaky red blood cells in the lungs is transported through the bronchi to the mouth.
Oh.
Hearken to thine inner voice and give thyself a bell. No task shalt be denied if thy will
so
be
bad.
strong and
30
true.
seconds
For
in.
when the bell
I'm
is
already
rung,
down one.
it carries with it the sound of courage
That's a full
that
one.
giveth strength to even the meekest of hearts.
All right, enough of that.
So ring thine own bell.
Okay. Okay, so read further, Tace. That's awesome. I
Well,
was
there's
Googling
just a
it.
couple of different things. Another thing, that was by Ohio State University. Another thing says the effort exerted on top of the existing irritation might cause the mucous membranes to bleed just ever so slightly.
Right, and then you could actually, I think the sensors and the tongue are sensitive enough to taste blood that you actually can't see. But it's the hemoglobin that makes the metallic taste
Yes.
because it's bound with iron.
It also says that from the Marathon Handbook, tasting blood in your mouth while running is a byproduct of breathing hard.
Yeah, but that doesn't answer the question, though. I know that stuff from the top of your airway can sometimes, if you've got an infection or something, can smell or taste metallic. But I think the metallic thing is blood. She's saying it tastes like
almost
blood,
wondering.
not just like metal.
Yeah, with that much exertion, maybe it's a little sinusy thing, maybe a little post-nasal kind of drip.
Yeah.
Or-
But
I like
interesting.
Tacey's answer. So
I do
far.
too. That's why she got the full Monty
Suck.
on the
You
give yourself a
suck,
bell.
Tace.
Anyway, there's all
That's gotta
kinds of
be it.
stuff
I
about it
agree, yeah.
on the internet. So,
Okay, well, can you tell us about the hemoglobin leaking from? You know about leaky junctions.
Yes.
So was there something else in there about the leaky junctions?
No, because I'm not even on that.
Because it makes
website
sense that
anymore.
if you're huffing and puffing and really exerting yourself, that the junctions between the epithelial cells, which are the cells that line, cavities like the lungs, would open up some, and there could be some a blood. Red blood cell or something leaking in there, and then the lung has got to transport that out.
I mean, it talks all through, about hemoglobin molecules in here. But, as it pertains to your question, I don't know.
Yeah, okay, interesting.
Yeah, proper breathing technique and exercise is super important, right?
Sure.
And if you're not breathing during strain, you're increasing intrathoracic pressure, and that could certainly cause some damage to those blood vessels. I'm wondering also too about reflux.
Yes.
There might be a little reflux involved there.
That was the other thing I was wondering about. I'll give you a bell for that one.
Thyself a bell.
Well, just because
Rookies
I don't
can't
know if
get
you figured
bells.
this out, but I give people bells when they say something that internally I was agreeing with. But I wondered about reflux as well. But that usually gives you a metallic taste, but not blood. It doesn't. I've had reflux before, and you get this sour kind of almost metallic taste, but I wouldn't characterize it as tasting blood. But that could be it.
Mm-hmm.
I sent you the article
Yeah.
that talks about it.
Okay.
Cool.
Yeah.
That's pretty awesome taste. I got to give it to you.
Yeah. Mm-hmm. Yeah. Red blood cells can leak into your alveoli during hard effort. It's temporary, nothing to worry about. If you always taste blood, you should see your doctor to rule out underlying health issues like infections. But this has been going on for years.
Forever.
So I think she just works out. I would like for I'm starting to get their voices. I think that was Jen. I would like for her to check her resting and maximum heart rate because I wonder if she's overdoing it. You know, there is a formula for that, which we could talk about. Let's see what she says, and then we could walk through the formula to figure out what your safe heart rate is and what your target heart rate is.
What about the pain in the neck?
Did she say she was having pain in the neck too? Oh,
Yeah.
yeah.
That was the other one, yeah.
Yeah.
She was talking about, she does an exercise, and she gets like a pain in her neck, back of her throat or something like that.
In the back
yeah.
of her throat. That would sound like that's coming from breathing.
Yeah, just choking.
They live in Maine. I don't know how humid it is up there, but if she's working out in the winter, it's probably due to dry air, be my guess. Now, having said that, we've talked about this case before on this show, but this would be something more recent where we had a patient at a university center that came in and was triaged to the non-acute side of the emergency room because he complained of sore throat. And when they went in to go see him, he was dead. Now, the reason for that was, after the autopsy, they figured it out. He was having a heart attack, a.k.a. myocardial infarction. And in those situations, you have chest pain radiating to the left arm, but sometimes people will have pain that radiates to the neck. And instead of saying, because not everybody's a textbook, I have left-sided chest pain radiating to my left neck, accompanied by shortness of breath, sweating, and nausea and palpitations, which would be sort of a classic presentation. He went in and said, I'm having throat pain. Yeah. And they interpreted that as, oh, this guy's got a viral URI, he's got sore throat,
up or something.
Stuck him over there, and then he had an arrhythmia and died.
Yeah.
So, and caveat for the providers out there, take a complete history while you're triaging somebody, but also for us as patients, make sure we tell them the whole story.
Yeah.
It probably wasn't the only thing. And it may have been, I was pushing my lawnmower when this started, or I was running up the stairs or something like that, so we got to give people the context.
A little bit more info, yeah.
Yeah, it didn't even sound like she was exercising when it happened to her, though.
Do I need to play it again? Was that?
I thought she said when she.
Okay,
when
well,
she
here,
it's right. Who knows? Forever.
Pain in my throat and neck, which probably means I'm having a heart attack or something.
When was the last time you had that?
I have it frequently.
Probably having a stroke.
That's what I'm thinking.
So I will actually taste. I'm not
Okay, so that was Carol saying that, and then this is Jen.
coughing, but my mouth and my throat will have a metallic taste, and I am convinced when I spit, it's
Right.
going to be blood.
Now, again, the metallic taste could be reflux. That could be.
Yeah.
If it's just happening,
When you're exercising.
just when you're not exercising.
Oh, yeah.
Now, the pain in the neck and throat, I'd like to hear more about that because, of course, Carol throws that in and then Jen just, takes over the conversation again. So,
Yeah, the pain in the throat is a little concerning.
Yeah, let's hear
Maybe
more about
some more
that.
information would
Yes.
be helpful on that.
yes. Carol, you can just send that in by yourself and then we will pay attention to you.
Quickly, send it in quickly, please.
All right. Let's move on. Well, of course, we have something that we can do right now.
It's Tacie's time of topics. A time for Tacie to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacie.
Well, hello, everyone.
Hello.
Hi, Tacie.
Okay, topic number 1.
Okay.
I can't read because my microphone is in the way. I've never noticed that before. Anyway, new Alzheimer's drug slows disease by a third. We are on the cusp of drugs being available for this. It seemed
Thank
previously
God.
impossible.
Because I know it's coming.
Eli Lilly, don't know how to pronounce this, donanemab,
Oh, okay. It's a monoclonal antibody.
slows it by about a third.
What?
Yeah, antibody made to attack viruses but engineered to clear a sticky gunk from the brain called beta amyloid. Amyloid builds up between brain cells and forms plaques, which is a hallmark of the disease. Full details are yet to be published, but, number 1, 1,734 people in early stages took part. Number 2, given as a monthly infusion until plaques in the brain were gone. Number 3, disease pace slowed 29% overall. And number 4, those given the drugs were able to retain their day-to-day lives.
Really? Okay.
Brain swelling happened in 1/3 of patients. 1.6 got dangerously swollen, and 2 deaths, maybe a third, occurred.
Ooh.
Eli Lilly will begin the process of having its drug approved for hospital use soon. That's from BBC.
Hospital use.
Yes. They said hospital use. I don't know.
That's strange.
So anyway,
Yeah. That's,
big deal though.
okay. Drugs slowed the disease progression by 35%. Yeah. Wow. Okay. Well, there were some pretty serious adverse effects on this. And there was another one, lecanemab, which was, touted as a new Alzheimer's drug. And it didn't quite make the cut because it had so many adverse effects. This one, some people, this Robert Howard, he's a psychiatrist at University College of London, says this one looks just as dangerous as lecanemab. So, but we think that this has got to be, at least a glimmer of hope for a safe treatment in the future. If this one doesn't make it, which it may not.
Maybe they're on the right path anyway.
Eli Lilly's going to hype it up, of course, but
No.
if you've got people dying of brain swelling when they have grade 1 dementia, there's seven stages of dementia. We use a score called the FAST scale, and 1 through 7. The first 5 are just you start off as being slightly eccentric, and then you can't plan a party, and then you can't do your checkbook, and then as you descend down that scale, then you start losing some real cognitive ability, and by the time you get to 7C, 7 is divided up into a bunch of different segments. People at 7C can't walk and can't talk, and they have trouble eating. So, it goes all the way down. If you are at class 1 or stage 1, and you just have some memory trouble, and then you take this, and then you get brain swelling, and you die, that wasn't worth it.
No.
If it works for you, and it slows progression so that you get an extra year of being able to do stuff before things get really bad, that's great. So what they need to do, if they can, is figure out what is common in the people that have the brain swelling, and then you can subtract those people out. It could be a genetic marker, who knows, but they got to figure this out, because these drugs are not going to get approved like this if they continue to have such serious adverse effects.
I had an Alzheimer's patient, once, and I had to remove her teeth and clean them every day. But she liked to bite me.
With their gums or with the teeth?
No, with her teeth. So I had to try to
Oh, God.
get in there and get her teeth out without being bitten.
How do you do that?
Well, I don't remember. It's been so long ago. But, it was like hell. I've never been so scared in my
Because you're
life.
an idiot.
It was terrifying. She was like, go ahead.
Oh, really?
Yeah.
Oh, she would invite you to do
Yeah,
it, and then you'd get your finger in there?
Yeah,
and
no,
she'd
she was mean.
It's a trap.
It was awful.
Oh, my gosh.
Wow.
That's awful. That is an awful story.
Did it for like a year. It
So
was
what'd you do?
terrible.
Just start smacking her in the back of the head, knock
Yeah,
her
I
dentures
just
out?
smacked
No,
her
you
around
can't
a little
do
bit.
that.
Oh, well, we know Tacie pretty well.
Yeah.
You ready for topic number 2?
Yes.
That's a good one, Tacie.
We should have a sound effect for these different topics.
Can magic mushrooms cure color blindness?
What? No.
This is from Interesting Engineering. And they used a test called the Shihara test, Steve,
Okay.
which is the most common color vision test. Before ingestion, A subject okay, so this is a study of one, okay?
Some guy took magic mushrooms.
Yep.
Yeah. He
And
self
I saw colors.
Maybe
in
they're
that.
having trouble finding participants that are both colorblind and
No,
connoisseurs
that would
of
not
magic
be-
mushrooms.
That would not be hard.
So I almost didn't do it, but I thought it was pretty interesting.
No, it's funny.
The subject self-administered this test and scored a 14. Now, if you get a 17 or above, your vision is considered normal, but a 13 or below, you have color vision deficiency. So 12 hours post-ingestion, he scored a 15. 24 hours post-ingestion, he had an 18. He peaked at 19 on day 8 after his mushroom experience. After a year, he scored a 16. So in conclusion, a single use of, how do you say it? Psilocybin
Yeah, psilocybin.
Yep.
may
Oh,
produce
pretend like
partial
you don't know.
improvements. Well, I started to say, ask the hippie. May improve partial improvements in CVD extending beyond the period of acute effect.
Okay, so this is pretty interesting. I've thought this was kind of BS, and then I'm looking at this. The Ishihara. So this guy did this on his own, and then he reported it to his doctors, and then they said, "Well, by God, we're going to do a test and just by God see." So the Ishihara test has these plates of colored dots, and they have these patterns, and they would be either invisible to someone with color blindness, or they would be only visible to someone with color blindness. And it's a pretty good, cool test, and it's a good test for determining color blindness. But the problem with color blindness is you actually don't have the rods or the cones that you need to detect those colors. So I don't know, or the chemistry in them is distorted so that they don't work. And I don't know how this would work.
That is pretty bizarre, isn't it?
Yeah. Yeah.
Wow.
So he reported 14, then a 15, and then an 18, and normal's 21.
Unless you've got normal rods and cones in your eyes, but it's your visual cortex that didn't
Well, okay.
interpreting the.
All right.
the,
I got it.
Self a bell.
I got to give you that one. That's possible, but I don't think that's how color blindness works. But maybe
I
in
don't
his
either.
case
Yeah,
it
yeah,
does.
I don't either, but I think that could be.
We don't go in and biopsy people's retinas and go, oh well, you don't
Yeah,
have
you're
the
colorblind,
correct
sorry.
green,
Yes.
thing. So absolutely, there's anything in that circuit could be screwed up.
Mm-hmm.
Oh, that's interesting.
Isn't it wild?
Yeah, see if you can find neurologic or neurogenic color blindness, because if that's a thing, and I don't know, I'm not. One thing we don't learn about in medical school too much is a whole lot of ophthalmology
Right.
and a whole lot of dental stuff
Or
And magic mushrooms.
or magic mushrooms. Although we did do pharmaceutical cocaine in medical school,
Yeah.
I've told you that story.
Oh yeah.
So, if we can find anything on neurogenic, because if he had that, then that makes total sense to me.
Because maybe it was altering the visual processing centers in the brain.
Right.
you know?
Well, again, kind of the same thing that he said.
Give
earlier.
thyself a bell.
But yeah, I'll give you a bell for that.
Appreciate that.
It says here, we would not expect psilocybin to repair his genetic defect, so it could never fully restore his color vision. Instead, we hypothesize psilocybin, there you go, improved processing of the limited visual sensory input entering the brain of this individual. So, yeah, it was doing it at the level of the cortex, just like Scott and Dr. Jeff said. So that is fucking fascinating.
Isn't that cool?
Sure is.
That's a good one, Tace. I'm going to give you a
Way to
bell.
go,
just
Tace.
for-
Give thyself a bell.
just
well,
for
this
bringing
next
that
one
up.
sucks, so get ready.
Okay, all right.
Okay, I did this for myself because I often have a puffy face, and I always thought it was Hashimoto's, whatever. But it is a puffy face a sign of a serious health problem? This is from the scientific. Did you just seriously put that on me?
Oh, did you turn it so it wasn't on you?
No, I don't. I did not shower today, and I do not want to be on.
But she
this
did-
is a radio.
But she brushed her
show.
teeth. She did brush her teeth.
I did brush my teeth.
I
Do
can
you,
tell.
do you use deodorant?
I did.
Do you rub a clean rock under your armpits?
Oh, I
A
used
country style.
I believe it was a Secret.
You can use baking soda.
You
Or-
are such a.
All right, anyway. Okay.
So anyway, this comes from the scientific magazine Good Housekeeping. Chronic facial swelling is often an early warning that something serious is going on. Now, we're not talking about just a little bit like, ooh, I had a little wine last night. We're talking about if you look like a blowfish
Oh, yeah.
or a dog after a bee sting.
Well, yes.
Which,
no,
yes,
that's
like
bad.
if you had that, so you need to go to the doctor. So I told you it wasn't good.
Yeah.
It could be a sign of inflammation in your body. Inflammation, hormones, or allergens can all contribute to it. If it comes out of nowhere, like not after wine the night before, and you have difficulty breathing or swallowing, have a pain or numbness, fever, or can't move part of your face, visit the ER
Yeah, no shit.
or call your doctor. Now, treatment for mild facial swelling, cold compresses, stay hydrated, sleep upright, take an OTC antihistamine.
This is for hangover or...
Yes, I believe so. Don't drink alcohol or eat salty foods, and don't sleep in your makeup, ladies.
Oh, really?
Yes.
So, yeah, so the kinds of facial swelling that we see that are really pathologic, the one that can come up suddenly is a thing called superior vena cava syndrome, which is where you actually have a tumor that is blocking the egress of blood from the head, and the whole face will swell up and maybe even turn purpley kind of color, and that is a medical / surgical emergency. Often they'll give you a dose of radiation to the tumor, and a lot of times people who have that didn't even know they had cancer. That's how they find out about it. And that's what fucking sucks about cancer. I'm going to stick my neck out and say cancer sucks and give me, ooh, what a hot take. But it instead of knocking the door, knocking on your front door and say, "Can I come in?" Which is, if it did, you could just shoot it with a double barrel on your porch, right? Mm-hmm. And what's that called? Castle rules or whatever, But instead of doing that, it waits till you're asleep and sneaks in the back window and knocks you over the head with a lead pipe like a bitch. Mm. So cancer can kiss my ass. No use for it whatsoever. There's no benefit from it. It needs to die. And we are very close, my friends. You remember a long time ago we talked about the lady, and if you're interested in this, go to drsteve.com and click on the menu and look for non-pseudoscience cancer cures. But there was a lady literally dying of stage 4 cervical cancer, and they said, "Well, do you want to try this new treatment?" And she was like, "Do I? What have I got to lose?" So what they did was they took some of her tumor cells out, mixed them up with her white blood cells, and then sent them back. And it was sort of like taking a sock and letting a dog sniff it and go find Scotty. He's out in the woods somewhere. And then the dog goes and finds him.
Yep.
Right? It was just like that, and that woman, to my understanding, is walking around cancer-free today.
Wow.
So they are now selling this as a thing called CAR T-cell therapy. So it's chimeric antigen receptor T-cell therapy, and it's actually on the market. Fabulously expensive, of course, and you have to get into a lottery most places to even get it if they have one that's based on your cancer. But this is just the first step, and it will become commonplace over the next, I think, 10 years. And I used to say this shit was 100 years away. It's here now. So, pretty amazing shit. So there you go. So
That concludes our topic time.
Very good, Tacie. Let me see. Thank you, Tacie. All right, I got to have an outro too. All right,
Good stuff.
you guys, you brought some stuff, didn't you?
Yeah.
Okay.
And we've got 2 questions from the Fluid family.
All right, let's do it. Fluid Family is our YouTube channel. This is a radio show, but we do have a YouTube presence just for the 5 or 10 people who want to hang out with us while we're recording. Scott and I said that from the day we started doing this that it gives it a little bit of different vibe because we at least aren't just in here masturbating with ourselves, circle jerk, where we have a group of people that we're actually talking to
Yeah.
live. Even if it's one person, it changes things.
It does help. It
So,
sure does.
But anyway, you can hang out with us. Check out my Twitter at Weird Medicine, or check our YouTube channel, which is youtube.com/@weirdmedicine, all one word. And then you can subscribe and like and all those things, and then you'll get notifications whenever we go live. Usually Saturday around 1 p.m. Eastern time. So anyway, what you got there?
Yeah,
Scott?
so love it. First question, very good. It kind of feeds into the second question.
Okay.
How can you tell the difference between a bacterial and viral infection?
Of the what, though?
Well, she just says in general.
Okay.
So let's just pick one.
Well, it's pretty easy. Let's do bacterial versus viral of the eye.
Okay.
Or of the nose. Usually, Dr. Jeff, you take this. Shit, I'm doing all the talking.
Sure. This is primary care, bread and butter topic, right?
Yep.
So, somebody comes in with conjunctivitis, let's say, right?
Yep.
They describe,
Which is infection of the clear part of the eye, or
Sure.
the whites of the eye.
and they describe, if they describe a dry sensation with kind of feels like sand and grit in the eye, and they talk about it being isolated to one side, not crossing the midline. Then they talk about how they take a nap and they wake up, and when they do, their eyelid is matted down, just crusted over with all this goop and crud. That really speaks to that being a bacterial infection.
And how would
versus
you tell the
viral.
difference between the two if you wanted to laboratory-wise?
So, we don't culture eye goop all that much. Just
Culture it, but what could you do? I'm stumping. It's called stump.
Got me
the
there,
chin.
Dr. Stump.
Well, you could swab it and look for white blood cells.
Oh, sure.
Yeah.
Sure.
So a bacterial infection more likely to have white blood cells in great numbers than a viral infection would. Now, viral infections do stimulate the body to make white blood cells, but there's a specific kind of white blood cell that we would look for, and they're very obvious. So
We also can look at patient population too.
Yep.
With the conjunctivitis. So your bacterial tends to be you're really young or you're really old. Patients that can't keep their hands away from their butts and then their eyes. Typical bacterial stuff. To where us folks
That's
in
what's
the,
causing mine. I was trying to figure it out.
those of us in the middle of
oh shit, eye.
Oh,
of
shit.
of the age range, we tend to get viral conjunctivitis because we get adenovirus or something like that. We get one of the common cold viruses.
There you go.
And that spreads up to the eye.
Yep. Very good. So next question.
Very good. So, and this is from AG, who is live with us in Germany.
Oh,
Yeah.
wow.
That's cool.
Say
Wie geht's?
Volkman. Yes. So, question. My daughter started kindergarten in January. I have been sick 1 week on, 1 week off since with tonsillitis. I've had it 3 times in the last 6 weeks. At what point are too many antibiotics a problem?
Oh, yeah. Okay. This is another primary care one. Why don't you take this as well, Dr. Jeff?
Boy, antibiotic stewardship, right?
Yeah. Why do we worry about antibiotic
Yeah.
stewardship?
So we have amazing antibiotics that are very well tuned against certain bacteria based on certain specific properties. Bacteria, though, aren't just sitting idly by and just letting themselves get killed off. They are adapting and they are evolving as they need to evade, our therapies. So we start taking too many antibiotics, or more often, we don't complete a course of antibiotics.
There you go.
And we induce resistance. And resistance sucks because, you get a sore throat, your PCP gives you antibiotics when maybe you didn't need it, and you only take it for 3 days because it was viral and it got better in 3 days. And now you've killed the good, healthy bacteria, and you've killed the weak bacteria.
Right.
And you've self-selected now for these really
That's
tough
right.
bastards.
Yeah, there you go.
And then you start spreading
Give
those around.
thyself a bell.
That was well deserved.
Yeah, that was well deserved. So no, you're still on a roll, but I want to just interject. So you have 100 bacteria, you kill 99 of them, but the one that is
The booger.
resistant, because it might have died if you'd taken all of your antibiotic, but you didn't, and this thing was just barely hanging on. Now it's going to multiply, and that'll be the only clone that's left is when that thing starts multiplying, and the doubling time can be a minute or two, where these things are just growing like crazy if they have enough nutrients. And next thing you know, you've got nothing but resistant population.
That's right. You've eliminated your healthy flora too. So now that one lone, assassin bacteria that you didn't kill has no competition for resources.
Right.
And it can just flourish.
And so, he says he had tonsillitis 3 times. I'm not doubting him. I might be doubting the primary care provider who saw him or her, his AG, anyway, saw them. And I don't know what the policies are in Germany, but we have real problems just throwing antibiotics at people. And tonsillitis really is characterized by enlarged tonsils, sore throat, and exudate, where you see, pus basically on the tonsils. And then we swab for that and see if it's actually bacteria or not, which is apropos to Lovett's question. And there are tests that you can do to see if it's group A strep, or you could, again, look at it under the microscope and see if you see a bunch of white blood cells, or you can culture it. And very many sore throats, particularly brought home by kids at school, are going to be viral in nature.
Absolutely.
And then we treat with antibiotics and then blah, blah, blah. So I would just make sure that you're really treating bacteria before you take an antibiotic. Yeah. And that's easier said than done when you're the patient.
Absolutely.
Particularly when the physician is trying to throw antibiotics at you.
Sure. And as their doc, the patient comes in, they feel lousy and terrible, and they're asking you for help. And, you got into this line of work to do just that.
Right.
But you have to kind of keep the big picture in mind that the best way to help is not to overprescribe.
Yeah. Well, when people come in and it's like, well, I've got this sore throat, give me an antibiotic. And then you go, well, take a little ibuprofen, do some fluids, try some, by the
gargling salt water.
Right. And then they go, fuck, I paid $150 for that.
Yeah. And they go out and call their buddies.
Yeah, that son of a bitch.
You got any leftover antibiotics like a Mari?
If there is no contraindication, by the way, if you have a viral sore throat or sore throat really from anything, the non-steroidals really work better than acetaminophen or paracetamol, which I think they call it in Germany, because it is an inflammatory problem. Sure. And of the anti-inflammatories, I prefer naproxen, which is naproxen, or just sold as generic, CVS and the blue pills, over ibuprofen because it lasts longer.
Yeah,
it's 12 hours instead of 4 or 4 to 6. And it may, correct me if I'm wrong, Dr. Jeff, may have fewer COX-related cardiac issues than ibuprofen does.
Absolutely.
It's safer. Yeah,
so
I think I'll give myself a bell.
Please
I'm not going to. No.
Please do.
It's all right.
I think Aleve the only one that doesn't have any cardiac.
I don't know if it's not any, but
compared to the other ones.
There are other ones like the non-acetylated salicylates, also don't, but you can't hardly find those anymore. That's like disalcid and salicylate and stuff like that.
Yeah,
so. Because those are aspirin-like.
Definitely. Sparing the cardiac effects. It's easier on the kidneys.
Right.
Lots of good reasons to choose it. Lasts longer, like you said.
And you don't want to miss, however, strep throat.
Yeah.
Because the only reason we treat strep throat is not to make the syndrome go away. If we treat strep throat with penicillin, the syndrome may go down, decrease by 1 day. But what we're really doing is preventing rheumatic fever and rheumatic heart disease.
Absolutely.
And yeah, go ahead.
This is such a topic in primary care that we even have a really good pretest for this, right? So we have something called the Centaur score that we use, and it's a set of criteria where someone can come in. They present, and we can base it. Its Centaur score is, I think it's 5 total. Age of the patient, if there's exudates or swelling on the tonsils, if they have swollen or tender anterior cervical lymph nodes. Oh,
yeah, that's
right?
a good one, yeah.
That's very specific for strep. Fever, and then cough. And it's not if you have a cough that you get points. It's if you don't have a cough.
That's correct. If you have a cough, then it's probably not strep.
Probably not strep.
Yeah. Very interesting. Very interesting indeed. And centaur is not like half horse, half human. It's CENTOR. Stupid. Should be centaur.
Dr. Robert Centaur, who devised this.
Yeah, of course he named it after himself.
Stupid.
His name is stupid. I invented, well, I can't, a formula from converting from one opioid to another, and I resisted calling it by my name because I think that's stupid.
Mm-hmm.
Just put it out there. You don't have to name it after yourself.
Mm-hmm.
Ugh. All right, well, let's do one. System duration. Okay, well, anyway. Oh, okay. Okay, so let's say you are, who was it, BG?
Yeah.
Okay, so BG comes in, and you're going to be BG. So how long have your symptoms?
Oh, AG. No.
AG.
Yeah.
Okay. How long have you had your symptoms? You don't have to ask them. You're role playing for them. Because we don't have time with the delay.
6 weeks.
So shut up.
It sounds like it.
Oh, is that
It
what he
sounds
said?
like
6
it.
weeks?
A week on,
Yeah,
a week off.
a week off.
Yeah, he said
Okay.
three times back to back to back.
Okay, so let's say 7 days, and so each one is 7 days, right?
For 6 weeks.
Okay, the Centaur rule only applies for symptoms less than or equal to 3 days. So we'll say 3 days, okay? And then age is great, 15 to 44?
Yes.
Okay.
43, actually.
Okay. Swelling or exudates on the tonsils, let's say no.
Nope.
Tender, swollen lymph nodes, no.
Nope.
Fever, no.
Nope.
Cough, present, I don't know. I'm going to say
yes.
yes. Okay. Okay, there's a 1 to 2% likelihood of group A strep pharyngitis. No testing or antibiotics required. Hey, AG, take the Centaur, CENTOR score, and look at it, and then let us know what the results were, and Scott will give us the result. And if you don't feel like doing that, take that to your primary care person who's treating you and see, because half the shit that kids bring home are viral. Well, it's way more than half.
And it's awful in kindergarten.
It does suck.
Awful.
Because all of these viruses have mutated since we were in kindergarten, and all these kids get together, and they're gooey, and they eat
So
each
gooey.
other's sandwiches and stuff. Yeah, go
And
ahead.
he can do a couple things, and this is true. You know, he can gargle the salt water. That
Yes.
can help protect him from getting another infection. He can do the nasal sprays that can help, keep him from getting infections too. So, especially with a kid in kindergarten, you're going to catch a bunch of stuff.
Yeah.
So maybe trying to keep from catching those in the first place would be a good.
But just
a good idea.
lavaging out your pharynx is what you're saying.
Of course, he's a little far away for his Simply Herbal's nasal spray, I think.
Yeah, we can get a Navage, though. That might
yeah.
help. I don't know that I have any data on if you use the Navage every day, if you get sick less frequently. That would be a good study for them to do.
Yeah.
If people don't know what I'm talking about, the Navage is the
It would make sense.
automated neti pot.
Yeah.
And if you go to our YouTube channel, you can see
Who was it?
NP Mel B.
Mel B, right? Yeah.
Yeah,
Mel B, yeah.
do the Navage. She hated putting anything in her nose. She was horrified, but it worked for her.
Longfeather's got a great question too.
Yep.
Kind of a follow up. He's asking, as far as NSAIDs, folks that are on Coumadin.
NSAIDs, non-steroidal anti-inflammatory.
Can you take an NSAID if you're on Coumadin?
Jeff?
So, on Coumadin or warfarin, you have to be careful with any medication. There's so many interactions. You have to be careful with medications and foods. And so it's not strictly contraindicated to take NSAID. Taking NSAIDs in the setting of Coumadin, no.
It increases the risk of bleeding because they interfere with platelet function, so I wouldn't do it. If I was on Coumadin, I would probably take acetaminophen for pain rather than... But if you're, ask them why you're on Coumadin, though, because there may be reasons that you could get off of the Coumadin, which is warfarin, and which is rat poison.
Rat poison.
Yep. I mean, we don't want to say this is not like a Joe Rogan thing where they were saying, well, he took vermectin and he was taking horse paste. He was taking a human drug for a human reason. And when we say warfarin is rat poison, don't get the wrong idea. They use warfarin in rat poison because when the rats eat it in huge amounts, then it induces bleeding in them. So that's why it's not. It is. Yes, it is also used as rat poison. But warfarin, if you're taking warfarin, you're not taking rat poison.
No.
So, So there are other drugs now, and some people get stuck on Coumadin and don't need it anymore, and they're on it forever. And you have to do blood testing, and you have to adjust it and all this stuff. So talk to your primary about, is there a compelling reason to still be on warfarin? There are still some reasons to take that over the Eliquises and other things of the world. All right. Any other?
Nope.
Okay. All right. Let's do one. We're going to do a blind voicemail.
Oh, gosh.
All right. And let me see. Okay. Let's try this one.
Hey, Steve. It's Evan from Wisconsin. And I, hold on. I'm gonna call back. Sorry.
Okay, all right. This is why we don't do blind voicemails. Let's try this one.
Hey, Steve, it's Evan
Oh, there
from
you go.
Wisconsin, calling in with a take two. I'm in my early 30s. I drink more than I should,
Okay.
and I also have these weird, painful lumps, I guess, on my both my side area and my sternum. They're pretty small, about pea size, and I can manipulate them, and it won't hurt. But if I put direct pressure on it, it leaves this kind of lingering pain. It's kind of hard to describe, like a kidney punch or something. But I've read it's from a fatty liver and is probably tied into my alcoholism, but just wanted to see what you thought. Thank you. Love the show. Fluid.
Thanks, man. Well, number one, if you're drinking more than you should, you can get help.
Absolutely.
Go to a meeting. Dr. Jeff, you can talk a little bit about that if you're cool with it.
Yeah, the alcohol is probably one of the strongest drugs that humans have formulated in our history. It can be a lot of fun until it isn't, and then it can destroy lives and relationships and careers and families and all of the above. There's lots of help out there, especially over the internet. You're listening to an amazing medical show over the internet. You can go to meetings, reach out to people all online. People have been there going through what you're going through. Help's out there. Find it, my friend.
Yeah, absolutely. I mean, you've identified that you have a problem. So how would you recommend someone who's actively drinking?
Yeah.
He's still drinking.
Yeah.
How does he get started on that?
So
we're gonna get to the lumps, but
yeah,
this is more important.
This is more important than that. So, the first thing is doing exactly what he did, recognizing that this is a problem. We call that step one.
Okay.
Right? Lots of research out there has shown that these 12-step programs are some of the best modalities we have for conquering this addiction. Find yourself a meeting. If you can't find a meeting, find somebody else who will listen. Family, friends, whoever it may be. Admit that you've got a problem, and then we can start taking steps to stop the drinking. Now, drinking is different than other drug use. It's different than smoking weed too much or doing coke or whatever. If you're an everyday drinker or 5 times a week drinker, this isn't something that you can just stop all the time. You can go into withdrawal that can be fatal.
That's right.
So we have to be really careful when it comes to alcohol, depending on how much you're drinking. And it's a process. It's a process of realizing that you got a problem, asking for help, getting a good support system behind you, and realizing that you're worth getting past this.
Yeah.
Your life, your happiness, the happiness of your loved ones is worth it. And there's a new day ahead. Mm-hmm. There's a better day ahead for you without the drinking.
Yeah. Very good. Yeah, absolutely. It's please, dude, just take that first step and then get back to us. We're here for you if you need, you can go to samsa.gov. I hate that they spell it so weird. It's SAMSH. No, shit. SAMSA.
See, if they would have spelled it weird.
Yeah, it is. It's pronounced SAMHSA because the H goes in front of the S. That's why.
Does, yeah.
So samhsa.gov. You can find treatment programs, but you can just go to aa.org too, right?
Absolutely. Another great resource that I'll put out there is called intherooms.com.
Ooh.
And this is a group of virtual meetings that are happening internationally around the world, 24 hours a day, 7 days a week. You name your addiction, they have a support group for you. Alcohol and drugs, obviously, most common in these groups, but everything from gambling addiction, sex addiction, whatever it may be.
Really?
And these are phenomenal because you can be as involved and as public as you want to be. If for professional reasons you don't want to, spread the news around, that's okay. You can be
This
anonymous.
is free?
Absolutely free.
Who the hell pays for this? This is an amazing website.
So those of us who have recovered and found success in life outside of this, we go back and we give money.
Really?
Because they save lives. Yeah.
Wow. Okay. Well, shit.
intherooms.com.
Okay. Check that out. I hope he's listening. Now let's talk about the lumps.
Yeah. So anytime I hear somebody who prefaces a symptom with, when I drink, I notice this, or when I've been drinking a lot, I notice this. Any kind of pain, or because he said they were painful, yes?
Yeah.
Yeah.
Oh, well, they're not painful. He can manipulate them.
Manipulate
But
'em.
when he pushes on them, they hurt.
They hurt. Okay. First thing that pops in my head is the Hodgkin's lymphoma.
No. Well,
No.
Sorry, didn't mean to beat it down there.
Oh,
I think these are superficial.
Superficial? Okay. Then I vote lipoma.
That's what you get for the.
lipomas.
I vote
yeah,
lipoma.
Lipomas. Yeah.
That's what you get with a new doctor. But it's easy to find out. Jeff, we tried not to just throw the C word out there
Sorry about
willy-nilly to people and have them shit their pants.
Sorry about that.
But it sounds superficial. These things sound like little fatty
tumors,
tumors. Not malignant fatty tumors. They are little collections of fat cells. The easiest way to know, though, is go to your primary, talk to them about these lumps, show them to them, let them poke on them. Maybe they want to take one off and biopsy it, then you'll know.
Yeah.
And then while you're there, say, I want to get into recovery.
Absolutely.
And there are things that they can do. They could send you to an addictionologist if you need pharmacologic help. If they're well versed in this, like most family physicians are, then they may be able to get you started with medication-assisted treatment, and then but it's just not taking a pill. Pills are great, and there are some great new medications out there like naltrexone and other medications to use, but it's got to be multifactorial. You can't just take a pill to conquer this.
Absolutely.
All right.
Absolutely.
All right. Good deal. All right. Well, listen. Thanks,
Perfect
everybody.
ending.
Of course.
Always is, though,
Why are
right?
you surprised? Well, thanks to everyone at SiriusXM whose steadfast support of the show has sustained us over the years. Thanks, Scott. Thanks, Tacie. Thanks, Dr. Jeff. Dr. Jeff, you're welcome back anytime you want to be here. Go to our website at drsteve.com. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise, and we'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody. All right. Now, you want to do another? I have a written question here, and I didn't know, Scott, if you had anything else.
No, nothing else.
Okay.
Yeah, let's do the written question.
Okay. All right. Let's see where we were there. I'm going to try to find a good exit point. Oh, yeah. Okay, yeah, so right there. Okay. Turn that off. Okay, very good. Well, it was very interesting. I've got a couple of emails that were sent to me. One of them is really long, so I'm going to abbreviate it, but I think it's kind of interesting. And y'all, you can email me stuff. Just call the voicemail. It works better. It's 347-766-4323. But this was both of these were good enough. I really wanted to read them. So this is from Kai in Connecticut. Said, I thought you might appreciate a lay person's experience trying and eventually succeeding in getting a colonoscopy done without sedation. Because, I've talked about how I like doing my colonoscopies.
Over and over.
For fuck's sake. For fuck's sake. Fuck the right
Lord and lady, douchebag.
Oh my God. Anyway, yeah. So I've had
something about a big hairy ass on a picture.
Yeah, okay, all right. But it says after hearing you talk about it, apparently over and over and over again. Well, he does say several times over the years. Okay, fuck off. I thought that I too would really prefer going without anesthesia during my first ever colonoscopy. There you go, because he's smart. I've never liked it. I've always asked the lightest possible amount during any invasive procedure. So I figured I'd go without it here entirely. So I quickly realized, unlike your experience with sedation-free colorectal cancer screenings, it seems since I, 1, am not a fellow physician, and 2, don't personally know the folks who'd be doing the screening, I had much more difficult time convincing them to do it. Literally at every step of the way, let me see. I had to remind every single one of them of my wishes. Each person went right into their, so do you have a ride home today? And, quote, during your recovery from sedation, you'll experience script. It was unreal. I can't tell if this was some kind of communication breakdown. I mean, obviously it was, but they just have it in their brain. It's just habit. Or if they're legitimately convinced people don't know what's best for themselves. No, it's not that. It's just that most people aren't aware that you can do it, and it's just habit. And you get into this mind drone where you just say, okay, do you have a ride? Do you they're not even looking at it. This was at a large city hospital in Connecticut. I'm convinced no one has ever requested not to be anesthetized here. I was initially annoyed by it, but then saw the hilarity of having to start my story over with every single person. As I mentioned, they even sent the anesthesiologist just into the room at one point. It was the shortest communication ever. Hi, I'm Dr. So-and-so, and I'll be your anesthetic. Nope. So the good news, it went right. Now listen, if they had a problem and they perforated your colon, they would have to anesthetize you. So it is good to still talk to the anesthesiologist, but just say, I don't need you. But they can put in an IV and have it ready in case you need it, okay? And because not everybody, some people will get into it and go, okay, I want the anesthesia, because they weren't expecting it to be as uncomfortable as it. But it's just uncomfortable. It's not horrible. Yeah.
What's worse, that or the cystoscopy?
No. When you say worse,
yeah, painful like the cystoscopy. Had to be way more painful.
Someone manipulating your ass or manipulating your cock.
Well, I've had one. I've not had the other. So
they were both equally just stupid. It's just stupid. And I wouldn't ask for anesthesia to have a cystoscopy. You're thinking you might? You're thinking you would?
I'm thinking I would consider it. Yeah.
I think squirt the numbing juice up the urethra and let it sit there for a few minutes before you just shove a damn tube in there.
I've got a better idea. How about why not drinking the numbing juice and peeing it out? No,
that would be interesting.
Numbs everything on the way. So
that
would be
if
too
they
bad.
had something like that.
That's my next $1 million.
They do have
idea.
pyridium, which is a pill that turns your urine orange, and it is an anesthetic for the GI tract. Yeah. I don't think it would help for a cystoscopy, though.
That's pretty horrible.
That might be something to do, though. That might be an interesting clinical trial. If people experience less discomfort, because Dr. Jeff, you probably haven't listened when we were talking about this, but Scott and I both had cystoscopies done, which is a little, fiber optic, for people who don't know, fiber optic scope shoved up your urethra so that they can look around your bladder. And they put numbing gel on it, but they just put it on there and then just jam the thing in there.
No,
and it's really
sit and wait.
That makes them.
I don't think you could sit and wait long enough.
That makes them feel better. It doesn't make us feel better.
Exactly
and if you've ever had an STD test, which I never have, but they take the little swab. Well, maybe I did before I got married. I don't know, but they take a little swab and they shove it up your urethra, and it's a tiny little swab, and then you have to twist it around, and people tell me that's just agony.
No thanks.
Very uncomfortable. But again, it's just uncomfortable. I tell people if you're going to quit smoking, what's the worst that's going to happen to you? You're going to be uncomfortable. Who cares? Who gives a shit? If you're a man and you smoke and you stop smoking, you'll regain that erectile dysfunction that you were lost or were going to lose. But you're just going to be uncomfortable. Now, if you just quit, as Dr. Jeff alluded to, if you just quit drinking, you could have serious side effects. So you want to do that under someone's supervision, a medical, encounter to make sure that you're not putting yourself at jeopardy. Same thing with benzodiazepines like Valium or Xanax. Same kind of deal.
Same receptor. Same.
Be very dangerous to just stop those cold turkey. But anyway, okay, one more letter. This is from Dr. Perkins. I don't know if it's Dr. Perkins or Dr. Perkins. I never know. It's just like we've got a place in town called, I thought it was called Mr. Cleaners, and they will correct you every time. No, it's MR Cleaners. Well, it looks like Mr. Cleaners. So this could be Dr. Perkins or Dr. Perkins. But it says, I picked up on one of your podcast discussions about the body getting too used to certain medications. Here's my question. After being on, and Tacie, you're going to answer this, after being on thyroid supplementation for 20 years, is there zero hope for my thyroid? And then he said, are there any odds of finding a treatable blood flow problem? And that's really not the problem with low hypothyroidism. You want to talk a little bit about?
I mean, Steve, I really don't know. It's a long road to get to the correct dose or to get to the right cocktail for being like Hashimoto's or thyroid. I mean, it's a long, terrible, difficult.
So Tacie had Hashimoto's
experience. It took about a year for me, and now I feel good.
And you start off with Hashimoto's, which is autoimmune, destruction of the thyroid, where you may have hyperthyroidism for a while when the inflammation is going on, and you may even feel good during that. Some people, if it's mild, they may feel kind of energetic and stuff, but then when it shuts down, that's when you feel like
just terrible. Like I've never felt so bad in my life.
And the problem is with people.
I could sleep. Well, I can still sleep, but anyway.
I have seen people come in, and when you treat them, it's so gradual they don't realize it. I've seen people come in and they're talking like this, and then you test them and their thyroid stimulating hormone is elevated and their thyroid is low, thyroid hormone is low, and you start to treat them. And then they come in, they go, hey, how's it going? And you go, can you tell any difference? No. And it's like, you're bouncing around now, and you came in here looking like, a sloth.
That's a good question. I mean, are you on the same dose forever? Because I have been for a few years.
Yeah, many people can be on the same dose forever.
So, I mean,
but there isn't hope for it's not blood flow, and there's not hope for just
but it feels
fixing.
Like blood flow.
Yes.
Yeah, it feels like.
I understand that.
I mean, like I'm a little Hashimoto-y today, and it kind of feels like my blood is moving kind of
Interesting.
slow.
Okay. Yeah. Well, that's how we perceive those things. Back in the day when we were just making up things, we talked about humors and stuff. You had melancholy humor and slow blood and all that kind of stuff. Yeah. So, that's where that comes from.
Yeah. So, I mean, if a person doesn't gain a bunch of weight or has any kind of changes like that, do they usually stay on the same medication?
Yes. Yeah. And what they do is they check your thyroid levels and your TSH, and they do kind of treat people as if they're numbers on a piece of paper.
Yes, they do.
When it comes to thyroid, and that's not always correct.
No, it's not. And I really wish that there was a whole damn semester on the thyroid.
Right, because
med school.
They messed Tacie up pretty bad. And, it's like testosterone. If you're low normal testosterone, but you're symptomatic, just because your number is above the low threshold doesn't mean don't treat. And I think they should do this with thyroid too. I feel like shit. My numbers are normal, but I still feel crappy. I think those people, if they're in the range, you could crank up their thyroid dose a little bit, see if they feel better. Just keep them in that normal upper range.
I mean, I had an endocrinologist.
Why can't you do that?
Tell me that I was just depressed, and I just got up and walked out of the room.
Right. Fuck that. And I'm going to give them a boo. Let's see.
I mean, he was not listening to my symptoms.
And here's the thing.
At all.
We shouldn't, as providers, and Dr. Jeff, as you go forward, aim for the lower part of the normal range just because you get somebody. So the range is, 10 to 100 of whatever disease, and their level was 5, and we bring them up and now they're 12 and go, oh, you're fine. They still feel like shit. Let's bump them up until they're 50 or 70, and then it's still normal. Why can't we do that? The thyroid people will not do that. If you're in the normal range, they won't titrate you up even if you are symptomatic, and I think that's incorrect.
Yes, very incorrect.
Some of this is art of medicine, but that's science as well, because if you're worried about that normal range, bump them up to the upper range. Why not? And keep them in normal, but just a little bit higher.
And then there's, I'm sorry. There's all this other stuff I don't understand, like T3, T4. And
yeah, don't worry about all
T
that.
blah, blah, blah.
Who cares?
But I want it to be good because I want to feel good.
Right.
So I want my doctor to know about that.
Right.
That's all I was going to say.
Often we call it the curse of the low side of normal.
Yeah.
Right? And patients get stuck in it, and
Yeah.
He's got a name for everything.
The low side of normal. Patients get stuck there. Providers get lazy, right? Because they're normal. But the low side of normal is no place to live. I agree.
No.
Agreed. Yep. I'm with you.
Agreed.
All right. You got anything, Scott?
No, sir.
All right. Well, good deal. Thank you, everybody. I'm temporizing because I don't have the right script up, although after 17 years you'd think I could do it without it. But thanks go to Dr. Scott. Thanks to Tacie. Thank you, Dr. Jeff. Very illuminating, and you're a great person to have in the studio.
Absolutely.
So you're welcome anytime. Unfortunately, he is moving to California. Is that correct?
I moved from California.
Oh, no, that's right.
Yeah.
You're not going back to California.
I'm not.
Okay.
Sticking around local. Yeah.
Oh, you are? Wait, local?
Relatively local. Compared to from California to where we're sitting now,
Okay.
it feels
All
local.
right.
Yeah.
Okay. All right.
Well,
You're
that could
local
be
like
anywhere.
you're local like Ahmed is local. He was going to drive here, and he had to get up at 5 a.m. to get here just to be in the studio. I said, dude, just come when you don't have to get up at 5 a.m. and you can hang out, because we love Ahmed. He's doing very well, getting
Good
ready
for
to
him.
become a senior resident.
Is
So,
he
yeah.
really?
Yep. Yeah, it's crazy. And
Plus, yep.
all right. All right. Well, thank you for coming, and you're welcome.
Thank you for having
As
me.
long as you're still here anytime. Listen to our Sirius XM show on the Faction Talk channel. Sirius XM channel 103, Saturdays at 7 p.m., Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Thank you, Jim. I mean, we're still on the air. I don't know why, but thank you. We really appreciate the fact that we are. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Check out Dr. Scott's website at simplyherbals.net. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Hello, Holly. Okie doke. Holly's my niece. We used to, all the shout outs at the end of the older shows were all her, except for like 3 people. All right. Let's do the intro and then we'll get out of here.
Shit.
What do you give a basketball player who never... Did you hear about the contest to win a ton of cow manure? To the victor, go the soils. Why did the dad cross the road? He saw another dad, working on a car. Why'd the cat cross the road? Because the chicken had a laser pointer. And if you like that, I can add my cat sounds.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network Studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred, the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacie. Hello, Tacie.
Hello.
Do you have topic time today?
I might.
Okay, awesome. And in the studio for the first time, Dr. Jeff, an osteopathic physician of great renown. Hello, Dr. Jeff.
Hello, Dr. Steve. Thank you for having me.
This is a show for people who would never listen to a medical show on the radio or the internet. If you got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. You like how I accentuated that? Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. All right, very good. Please don't forget stuff.drsteve.com, stuff.drsteve.com for all your online shopping needs. I understand that people with iOS were having trouble accessing that site. Dr. Jeff and I are going to figure that shit out because it works fine for me, but that may be a problem for some people. If you're having trouble with that, let me know. Stuff.drsteve.com. And you can have ad blockers on. It's fine. You just click through to Amazon, then they're all, but you won't see the rest of the page. And then if you're interested at all in non-pharmacologic treatment for your erectile dysfunction, check out the Phoenix Acoustic Shockwave therapy. Same stuff you would get if you go to a med spa and have a stranger holding your junk in your hands and running this probe up and down for multiple visits for thousands of dollars. You go to ed.drsteve.com, like Echo Delta.drsteve.com, ED for erectile dysfunction. No shit. And you can get a discount for that thing. They have a payment plan. It ain't cheap, but it's a lot cheaper than going to a med spa and having this done. And it really has some decent data behind it. So I don't like to plug things that I don't think work and or that I wouldn't use myself. So I'm in my second phase of doing that. And Tacie will let you know how that's working later, I guess.
I guess we have plans.
Or whoever. Okay, tweakedaudio.com, offer code FLUID, F-L-U-I-D, for the best for the best earbuds on the market for the price and the best customer service anywhere. Use offer code FLUID to get 33% off your order. And simplyherbals.net, Dr. Scott's website, with the best CBD nasal spray ever made, and maybe the only CBD nasal spray ever made. Do you know?
Yeah, it's the only good one.
We've been okay.
I don't think there's any other ones at all.
I've not seen any.
No, I don't think so.
You're the number one CBD nasal spray in the country, I believe. Yep. So that's just my personal belief. And we've been running some of your ads at the beginning. Have you noticed? Have you noticed anything?
Very good. Yes.
Oh yeah. Okay. Good. Yeah. Patreon.com/Weird Medicine. That's Tacie B. We're going to record tomorrow a new show, and Tim Dillon has agreed to be on. But then when I follow up, then I get crickets. So we'll see.
Yeah.
Tim and I are sort of buddies, so I think we'll be able to get him on at some point. But it's fun. We've had a bunch of lunatics on there. We had Chad Zumach, we had Gino Bisconte, we had the Troika of Opie and Anthony, Mark Norman, Pete Davidson, other folks. It's worth getting in there just listening to the old stuff. And then there's classic Weird Medicine episodes that are no longer available on the internet. And then I swear I'm going to start doing these live streams. It's coming. Mm-hmm. I just want it to be right when I do it, and I just right now don't have time because of my job to sit down and do it right the way I want to do it. But it's coming. I promise it's coming. So check that out. Patreon.com/Weird Medicine. And if you just want me to say fluid to your mama or whatever. Oh, and you know who else got a Patreon from or a cameo from me the other day? Dr. Scott, your favorite person.
Give yourself a beer.
It was Cassidy's birthday, and her dad got her a cameo from me, and I didn't realize who it was.
Funny.
So I would have said, give yourself a bell to her or something.
Funny.
But instead, I just told a bunch of dad jokes. So
yeah, she's good. She's good.
She's a good kid, and her dad is a cool guy. So anyway, there's that. So yeah, she did a cameo. So cameo.com/Weird Medicine. It's unbelievably cheap. Mm-hmm. I mean, I do it just for fun, so they won't let me charge $0. I would charge $0 if they would let me.
He would.
I absolutely would. It's so much fun to do. Anyway, all right. Anything else?
Nope.
All right, there you go.
Wrap it.
Let me
wrap it up.
Turn the air conditioning back on.
Are we done?
Well, you are, unless you want to sing.
No, I don't want to sing.
Now,
I need to shower.
Dr.
But
Jeff,
I'm
you
not
play
ready
an
to do that
instrument,
just
right?
yet.
I play a very poor guitar.
Have you got your guitar over there? He could play some songs with us. Where's the acoustic? Am I not looking at it?
No, that's my electric. He can play my electric.
Oh, that's your electric guitar?
Get out of your way.
Get me out of here.
I'm gonna let you out.
I guess I need Steve. It's 2:20.
Okay,
When
I know.
He's coming at 4.
Yeah, I don't have to
We'll
feed
be
her
quick.
at 4, though, right?
We'll be quick.
No, we're not feeding her at 4.
Okay.
We'll be quick.
Yeah, we'll be quick. Okay, hang on. I need to save this. Save as.
Yeah, do that first.
Okay. This is not in documents. Stop that. Where's my Dropbox? There it is. Okay, so this is
5/6.
05, 06, 23.
Yep.
Broadcast
5/13.
05, 13, 23. Okay. What you hunting?
Can you make a C and a G?
I can make a C and a G. I can do that.
You're good. You'll fit right in.
Where's the acoustic guitar? Is it downstairs on the guitar rack?
Yeah, I reckon it's down there. Yeah, I hadn't brought it up in a while.
This is beautiful, Scott.
Oh, that's what PRS yellow.
Goodness gracious.
She's a big.
Love it.
She's a big. Hey, brother, you gonna need that? Kind of just run it under the table. Steve will have to give you a little bit of juice on fire. Because I'm going to take this right here. Test.
All right.
Take it, Jeff. That may be that should be pretty close to tune. You can have this in 2 seconds. But that should be pretty close to. Oh shoot. Take it, dude.
You gonna give him the normal plug-in? Did you give him this one?
Yeah. Yeah.
Okay.
Yeah. That should have some heat. heard Van Morrison's Brown-Eyed Girl coming over here, and I thought, I wonder if we could play that.
I don't know how the bass part goes on that.
DCG. Hey, hey.
Oh, wait a minute.
Hey. How about some reflux?
Yeah, you need some reflux.
How about some reflux?
You taste blood.
Hey, where did we go? Hey, when the rains came in, down in the hollow, playing a new game. Laughing and a running, hey, skipping and a jumping in the misty morning fall with hearts a thumping and you.
What is that?
It just for
that goes to an E?
No, it still stays. It goes to a D and then a C with you, my brown-eyed D girl, and then it resolves to D minor. Then and then back to C. You're my D brown-eyed G. So that's the only weird part is that little turn.
And G do D do D.
Yeah, we used to sing la 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 la. Sha la 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 ti da la ti da. Back to G.
Now when it goes to when it changes,
yeah.
You just threw out a bunch of chords, so I don't know the structure of it.
No.
So.
Yeah, I'm gonna take you through it right now.
So when it goes to the minor,
it's the very end. So let's just the verse is normal G C D.
Yeah, right.
But then when it does when it goes in the misty morning fog, C.
Well, wait,
back to G.
Back up to how it gets there. Though.
Okay, yeah. Let's just start at the very top. Hey, where did we go? Days when the rain came. Down in the hollow, playing a new game, laughing and a running, hey, skipping and a jumping in the misty morning fog, all on the hearts of thumping with the C, D, my brown-eyed girl, E minor. You're my brown-eyed girl. Whatever happened? Tuesdays are oh so slow. Going down the old mine with the transistor radio. Standing in the sunlight laughing. Hiding behind the rainbow's wall, slipping and a sliding, hey, along the waterfall with you, D, brown-eyed girl, E minor. You're my brown-eyed girl. Yep.
Why'd you stop?
Because I lost my headset.
Oh. Okay.
But
now,
that's
Jeff,
it.
let me.
So you got
Jeff, I need to hear you.
Yep. You got it? All right. So I think we're good now. We're good now. That's a great song.
All right, let's do it.
Bob Bobbington. Hey, Bob Bobbington.
Let's do it.
Let's do it. You got it there, Jeff? Oh, there it is.
Yep.
A G. All right, so I'll kick it off and then.
All right.
Yeah, I think I can run that. Hey, where did we go? Hey, when the rains came, hollow, playing a new game, laughing and a running, hey, hey, skipping and a jumping. In the misty morning fog with all our hearts are thumping with you. My brown-eyed girl, be my you, my brown-eyed girl. Whatever happened? Tuesday was oh so slow. Going down the old mine with the transistor radio. Standing in the sunlight laughing, hiding behind the rainbow's wall. Slipping and a sliding, hey, hey, all along the waterfall with you. Brown-eyed girl, you my brown-eyed girl. Do you remember when we used to sing sha-la-la-la-la-la-la-la-la-la-dee-da, just like that. Sha-la-la-la-la-la-la-la-la-la-dee-da, la-dee-da. It's time for the bass solo.
What?
It's time for the bass solo.
No.
So hard to find my way now that I'm on my own. I saw you just the other day. My, how you have grown. Can't remember back there, Lord. Sometimes I'm overcome thinking about making love in a green, green grass behind that stadium with you. My brown-eyed girl, you my brown-eyed girl. Do you remember when we used to sing sha-la-la-la-la-la-la-la-la-la-dee-da, sha-la-la-la-la-la-la-la-la-dee-da, sha-la-la-la-la-la-la-la-dee-da, sha-la-la-la-la-la-la-la-dee-da, la-dee-da.
Whatever.
I was supposed to fade out, but I didn't.
Probably
fade
have
out.
to come up with a structure to that.
Yes, if I would have faded out instead of fading away, that would have been better.
All right.
That's a great tune.
I messed up a bunch in there, but I've got it now.
Yeah.
So if we played it again sometime.
That's a good little tune.
Yeah,
though.
that's a good one.
That's a good tune.
Yep.
Let's see. See if anybody's got any. Let's see if anybody's got any ideas for any other music. Yeah. Let's see. Amanda says it's it's one of her favorite songs in college, I guess.
Oh yeah. Well,
Yeah. What do you think here, Jeff? You got it? Pretty sure you can handle
Oh,
it.
how about the Patsy Cline song?
Oh,
That sounded good with the guitar.
Yeah, let's do that one. That was fun.
When we do,
Wasn't crazy. It was I Fall to Pieces.
I Fall to Pieces.
Yeah.
Can you find the chords for that, Jeff?
Yeah.
And then, that's a good one.
Yeah. So Jeff, it's going to be. We're going to do it. Technically, I guess it's in G.
Just tell them
So it's version 1 if you're on Ultimate Guitar, yeah. So it's going to be Patsy Cline's I Fall to Pieces. Version 1 should be, the intro is Steve will do a walking bass. Boom, 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 boom. There you go.
Is that right?
Yeah, I think so. And then it resolves on a D, and then it's I fall to pieces each time.
Wait,
is that right?
No.
Oh. I don't think that's the chord I'm singing in, is it?
G is I
fall to pieces each time I see you again. No, hell no, that's not close.
Okay.
What the hell is that? Hang on, let me go back to the. Hang on, Jeff. Somehow I've managed to do this incorrectly.
Yeah, you're right.
Yeah, it should be D A.
Yeah,
it should be D E. Yeah. There you go.
Wait. Wait a minute. What are we doing wrong?
That's what I fall to pieces.
I've done the song 1,000 times.
I know that's what's so bizarre. Well, let me see if there's one more key. Hang on 1 second. That's the right. What'd you kick that off on? That's a
C?
C. That's what I thought. I fall to pieces.
No, it'd be.
Hang on.
Fall to pieces.
I can't believe we can't do
Well,
that.
we
That's
haven't-
so bizarre. I fall.
Let's just play the song. Let's play the song, and then the correct intonation will come.
Something will come to us, right? I fall.
No, that's the intro.
Yeah.
Okay,
So
let me find the
bizarre.
music.
I'm sorry. Something just is not clicking.
That's so weird. That's why we're shit musicians. Because it starts on the 4, and then you start on the 1.
Right.
The
So
4 is the
A,
intro.
C, D, E, F. So
Hang on. No, hang on. Fuck off.
Hang on.
That's not right. What are we doing wrong?
Geez. So maybe it starts on a 5. If it's a G and then it goes back to the C.
Hang on.
I fall. It's C. No, it's C. How about CF? How about CFG? I fall to pieces.
That's what we were playing.
Yeah, okay. But yeah, this. What? Yeah, something on this is not right. Oh, you know what? I wonder.
Hang on. Okay, hang on. The intro is C, D, G. So let's just set that up. Okay, and then. Yeah, that's it.
Yeah, and I think you are correct. Yeah. So it's yeah.
So let's just do the intro,
Yep.
and then play the song, and then you'll get where we're supposed to be. It's so weird that we're both having that problem. Okay, you ready?
Yep.
1, 2, 3, 4. Wait, Are you not going to play?
No, go ahead. Yeah, go ahead.
2, 3, 4, C, D, G. Then you start on G. No. G. I fall to pieces.
Okay. Yeah. Each time I see you again, I fall to pieces. How can I just be your friend? Well, you want me to act like we've never kissed. Want me to forget, pretend we've never met. And I've tried, but I haven't yet. You walk by and I fall to pieces. Let's do it again from top. Keep going. Yeah, go ahead, Steve. I fall to pieces each time I see you again. I fall to pieces. How can I just be your friend? Well, you want me to act like we've never kissed. You want me to forget, pretend we've never met. And I've tried, but I haven't yet. You walk by and I fall to pieces. You guys, Jeffy? You good? Just GCD, yeah. Starting on G, yep, ready, 3, 2. I see fall to D pieces. See, each time someone speaks your name, G, 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 I fall to pieces. Time only adds to the flame. Well, you tell me to find somewhere else to love. There we go. Someone who loved me too, the way you used to do. And each time I go out with something new, you walk by and I fall to pieces. Well, you walk by and I fall to pieces. There we go.
Terrible.
I cannot believe.
Why were we having so much trouble?
You know what? I kept looking at it.
You just weren't used to singing it so high. Yeah.
It was.
Could you drop it down a lot? Yeah. Could you drop it down an octave?
Yeah, we can drop it down.
No, you drop it. Your voice.
Oh, just my. I fall. Okay. D, just plain D, yeah. Just plain. Yeah, you're just plain GCD. Just plain CD, yeah. Yeah, don't worry about any of those other changes. If you just drone
those are trans. Those are transient chords to just lead you from one thing to the other. So really, that's the D.
Is there a way to get a little more of me?
A little more of you into yours.
Yeah. Hang on.
Yeah, so what we'll do,
I can treat you guys triage to give results.
Well, I'm trying to keep you low because that thing's out of tune.
Oh, is it out of tune?
Yeah.
Yeah, we will not screw that up again, people. We're very sorry. That was terrible. All right. Oh, love it wants limbo. We'll do limbo next time. Okay. Yeah. So what we'll do is when we get to the bass break, let's just go straight through twice. Just the G, C, G, D. Yeah, and we'll let Steve do a little. There you go. So
yeah, now you sound like Orville Peck now.
There you go.
Oh, we could do.
So you just kind of drone right over it. That'll be perfect.
See the boys as they walk on by.
Shit. We better finish this song first. Okay. And then we'll do that. Yeah. So all right, Dr. Steve, kick it off.
Ready?
Yep.
2, 3, 4.
I fall.
Shit, I fucked up. Let's do it again.
That's okay. Yeah,
2, 3, 4. Let's just do that once.
Yeah, okay, just once.
Do the intro once.
10-4, yeah.
2, 3, 4.
I fall to pieces each time I see you again. I fall to pieces. How can I just be your friend? Well, you want me to act like we've never kissed. You want me to forget, pretend we've never met. And I've tried, but haven't yet. You are mine, and I fall to fall to pieces each time someone speaks your name. I fall to pieces. Time only adds to the flame. Well, you tell me to find someone else to love, someone who loved me too, the way you used to do. But each time I go out with someone new, you walk by and I fall to pieces. You walk by and I fall to there you go, love it. That was a little better. Ivers wanted us to play something last time. I can't remember what Ivers wanted. Ivers. What did we play for you last time? All right, Steve, you gonna do your song?
No.
Jeff, what? Do you have anything Grateful Dead?
It would sound good with that guitar, though.
Yeah.
What's it called? Dark of Night. Yeah, I'll do it.
Now, hang on there. Let's find it. Dark of Night. Give me 1 second.
Dead of Night. Dead of Night.
Dead of Night. Gotcha. Dead of Night by Orville Peck. All right, Jeff.
Dead of Night.
You don't know this song?
No.
Yeah, don't feel bad, Jeff. Neither does anybody else.
Yes, they do. Dead of Night by Orville Peck.
What genre is this?
Country.
This dark hollow town, cars and nights, the baby that's high, spend Johnny Knight's cash, hitching another ride. Is that how it goes?
No.
Isn't it a great little guitar, though?
Oh my God, it's gorgeous.
Nice, yeah.
It's great too. How long you had it?
About a year. Yeah, about a year. It's been over here 99% of the time. Oh, yeah. No, I love it. It's got a wonderful tone. You know, they upgraded those pickups there.
Sun goes down, another dreamless night. B minor.
Yeah.
You're right by my side. You wake me up. You say it's time to ride. In the dead of night, strange canyon road, strange look in your eye. You shut them as we fly, G, as we A. Okay, that's as easy as that.
Yeah. I was gonna say, where the hell are you? Oh, this is that one that starts. All right, Jeff, this thing starts way up top. The verse is up where there are a bunch of lines, which shows the tabs. So that's why I was like, where the hell is he?
Just go down to the chords.
Yes. We're just Jeff. You and I are just going down to the chords, and he'll sing down to us. Yeah. So you just
D minor, B flat.
Yeah. B minor A. Yeah.
That's the intro. It's just D, E minor,
B minor,
B minor,
A.
And you can do whatever you want to with this because it's just, if you want to play the chords or, yeah, there you go. So you do that, D, E minor, B minor. And then it says you shut them as we G fly, as we fly.
A.
Then it does the verse again.
Yeah, back to the D.
Stark hollow town,
E minor.
Carson City light. And that should be with some rhythm. You want to chunk that. You only do the slow chording at the first verse. And after that, it should be chung, ching, 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 Carson City lights. Well, I'm talking to him more than you can play the chords the way you are. Okay. And then in the dead of night, and then the chorus is C, G, see the boys as they A on by, D, E minor, G's and these boys as they A on by, and then it goes G. They walk on by, as they walk on by, as they walk on by, then it's enough to make a young man. And then it goes back to
Yep,
right.
We'll do it.
Try it.
Bring it, Steve.
All right.
Bring it.
2, 3, 4, intro. Oh, God. D, E minor, B minor, A. Here we go. The sun goes down, another dreamless night. A, you're right by my D. You wake me up. You say it's time to ride. In the dead of night, strange canyon road, strange look in your eyes. we fly, as we fly. 3, 2, 1, go. Start Hollow Town, Carson City lights. Baby, let's get high, son. Johnny Cash, hitch another ride. We laugh until we cry. You say go fast, I say hold on tight. In the dead of night, dead of night. See the boys as they walk on by. See the boys as they walk on by. As they walk on by. E minor. As they walk on E minor. A as they walk on. It's enough to make a amen. 6 summers down, another dreamless night. You're not by my side, scratch on the moon like a familiar smile. Stained on my teeth, my mother town, someone else's life. Dead in the night. In the night. 1, 2, 3, see. See the boys as they walk on by. See the boys as they walk on by. See the boys as they walk on by. 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 It's enough to make a young man. That's a great fucking song. That's a great fucking song. Even though we play it, you know.
Oh, I love it. All right, boys and girls, that's enough torture for the day.
If I could have live mixed that a little bit.
That's enough, guys.
That guitar is perfect for that song.
Yeah. Well, I'm glad, Jeff, he lets you play. He won't let me play it.
What?
He said you can't play it, too.
Well, you can. I just love you. I think your forte is that damn Ratliff mandolin.
Oh, I love it, don't you?
Yes.
All right, everybody.
You play mandolin at all?
Not at all.
Check it out.
So can you play a little?
Thank you,
can
everybody.
You play a little.
What?
What's the? For me, it's the prototypical mandolin song. Losing My Religion. R.E.M.
How's that go?
What, the REM song?
Yeah.
Losing My Religion.
Yeah.
Pull it up for me, will you? Give me.
That was the first song.
That's me in the corner.
Hang on, brother.
Oh, that'd be a good one. Oh, we could play
Steve,
that.
pull it up, but let me hear it.
Well, just get the I don't. We got a copyright strike on our last video.
Never mind.
Because I pulled up 2 seconds of Brent Denon. You'll know it. Hang on a second.
Yeah.
Who sang that?
REM.
Yeah. Right.
Just go to the the ultimate chord. It's right there. Losing My Religion chords.
Oh, life is bigger.
It's bigger than you, and you are not me. I met him.
Michael Stipe?
Yeah, he was at Moogfest. And he was wearing a flannel shirt and big, bald with a big beard. And so I'm at the burger place after the thing, and there's Michael Stipe right in front of me. It's like, Mike, I thought he was vegan. So he's in there in line, and I'm like being really cool. And then right before he went up, I was like, hey, Michael, your money's no good here. I was going to buy whatever he was buying, right? And then I look, it wasn't Michael's type. It was just some other asshole, because there were a million assholes there with flannel shirts, bald head, and big giant beards.
The burger stand was a giveaway, though, huh?
Yeah, you're right. I should have known. But we laughed, and I said, dude, I took a picture with Michael Stipe. I said, here's why I thought you were Michael Stipe, and I showed him. He went, oh yeah, I see that.
Oh, how funny!
It was funny.
Let me see if I'll just put it on my phone.
Yeah, do it on your phone.
Hang on, Jeff. Give me 2
That's
seconds.
a great song. Shit. Yes, we should do this. Now we're gonna butcher it right now, but we're gonna learn.
Oh yeah, that's okay though. I'm good at butchering. Okay, here. Hang on. I've found it. Let me listen to it real quick. Just give me 1 second. It looks like it's in a.
I think it's in F.
Yeah, F. Yeah.
Maybe it's G.
I think it's.
Well, A minor,
A
E
minor,
minor, A minor, E minor, and G, A minor. Oh no, this is an A minor.
A minor.
That's me in the corner. That's.
Let's see. Oh, okay. Here you go.
That's me in the corner. That's me in the spotlight, losing my religion, trying to keep up with you. I don't know if I can do it. Oh no, I've said too much, hadn't said enough.
There you go.
There you go.
That's it.
Yep.
Okay, here you go. I think.
Yeah, that ring right there is it.
Oh, life is bigger than you, and you are not me. The lengths that I will go to, the distance in your eyes.
Oh, I've said too much. I haven't said it enough. That's me in the corner. That's me in the spotlight, losing my religion. Sing it, Jeff. Trying to keep up with you, and I don't know if I can do it. Oh no, I've said too much. I haven't said enough. I heard you laughing. That's a G, so that's an F.
Yeah. Oh, it's okay.
So, I thought that I heard you laughing. All right, Jeff, you gonna sing it?
No. I just
thought that I heard you laughing.
I thought that I heard you sing. I think I thought I saw you try.
And then it just goes back to the thing. So let's just do.
Yep.
I thought that I heard you laughing. I thought that I heard you sing. So it's I D minor, G heard you sing. It's I thought that I heard you sing.
So let me see if I can get this thing.
Oh yeah, you might have it.
Oh yeah, that's what I typically do.
Think I saw you try. And then it goes back to the G. It resolves to the G, and then it goes back to every whisper of every waking hour. I'm choosing my confessions. Okay? That's the only hard part is the bridge. Okay?
Yeah, the bridge, yeah. All right, Steve, you singing it?
No, you guys are.
Oh, life is bigger, bigger than you, and you are not me. The lengths I'd go to, the distance in your eyes. Oh no, I've said too much. I haven't said it all. That's me in the corner. That's me in the spotlight, losing my religion, trying to keep up with you, and I don't know if I can do it. Oh no, I've said too much. I haven't said enough. I thought that I heard you laughing. I thought that I heard you sing. I think I thought I saw you cry. Every whisper, every waking hour, I'm choosing my confessions, trying to keep an eye on you, like a herd lost and blind fool. Oh no, I've said too much. I haven't said it. Consider this, end of a century. Consider this, the slip brought me to my knees and felt the what if all these fantasies come curling around. Now I've said too much. Thought I heard you laughing, thought that I heard you sing. I think I thought I saw you cry. Woo!
Yeah.
That just ends there?
No.
Wow.
I ran out of breath. That's a lot of words.
You got it, though. You got that tempo on the bridge, right?
Yeah.
About to get it. About to get it. It just takes me a little bit of...
It's tricky.
That's a good fucking song.
Great.
Whose idea was this? Yours?
New guy?
Yeah, was it? No, that was a good one. That's a good one. Oh, we're going to do that.
Okay, we can do it.
Wasn't bad for the first shot at it.
No, we've done worse. We've done worse.
Let's keep that. Put that on the list, will you?
Yeah, I'll highlight it.
Okay.
I'll give it
We
a
gotta,
heart.
if we could do that one well, that would be a really fun song to do. And I wanted
different.
I wanted the mountain sound. You can use your mountain voice too.
Yeah. I can do that. Yeah, we
some old country feller singing "Losing My Religion's" pretty cool.
The juxtaposition of that is pretty cool.
Yeah, Jeff, you missed our last week. Steve,
fuck off, Shannon.
Steve did a.
You have beard enough for both of us.
I'm going around the mountain, and I played on banjo, and he sang it. It was great.
Coming around the mountain.
Oh my God! All right,
Yeah,
boys,
Myrtle
girls.
sang it. Oh, can you push that mic that way because the fan is hitting on it. There you go. That's good. That's good. Thanks.
Y'all be good.
We're going round the mountain. Oh, yeah, Stand would be good. Or by R.E.M. Stand in the place where you are. Well, where else are you going to stand? You bunch of hippie fuckers. I ought not to say that. I ought not to say it that way.
That's a mighty foul word coming out of them sweet lipsy horn.
Yep. Stand in the place where you are, like you're going to stand somewhere else. I don't understand these kids today. I surely don't.
All right, well, I'm out.
Well,
going to do some chores, I guess.
Y'all are a bunch of
Back
good.
to reality.
Now I got to deal with 2 drunk women the rest of the day.
Yep.
All right.
You're a lucky man.
She going to stick around here and practice, you think? Yeah.